Hi friends! I was asked to do a little video on how ultrasound imaging in pelvic physical therapy, or OT, can actually help you if you are not just having pelvic pain, because I think there's a misconception that if you're coming to pelvic PT, then you just have pelvic problems, and that's wrong. So you have a respiratory diaphragm. This is the one I want to talk about, because if you want to see I did a video about transperineal ultrasound and imaging the internal organs and where everything sits. Go and look at that one if you want to see how that can benefit you. But this one is going to be all about respiratory diaphragm. So let's talk about that. You have a respiratory diaphragm that sits between about your eight thoracic vertebrae and your second lumbar vertebrae. So it's big, right? The respiratory diaphragm is a pretty big muscle. And if you have watched any of my other videos, you well know that the respiratory diaphragm is connected to the vocal diaphragm and the pelvic diaphragm via multiple outlets, multiple variables. One is fascial, for example. One is neural, as another example. So why is imaging the respiratory diaphragm important? Well, because your respiratory diaphragm, if it runs, it attaches to multiple things, to the spine, to the rib cage, to tendons of your hip flexors. It is innervated by the same nerve that innervates the vocal folds, right? So it is attached to multiple things. It influences intra-abdominal pressure, spinal stiffness. It is like a sump pump for the pelvic region, for the pelvic bowl. And if it is not shaped properly, then you have a problem, because all those things that I just listed, the abdominal wall, the spine, the rib cage, the hip flexors, the vocal folds, everything becomes impacted. So I love imaging the respiratory diaphragm. Now, I thought about whiteboarding, what it looks like on the screen. But honestly, I am a really crappy drawer, so I'm going to show you on myself. The respiratory diaphragm being shaped like this should be a shape that on imaging looks like that. Okay, so when I see it on imaging, it's this nice kind of upside down bowl shape, like a deep bowl that's narrow. And if you don't have good apposition, so I'm going to use both hands to demonstrate apposition. If this is my respiratory diaphragm and you don't have good apposition, what does it look like? It kind of looks flat, right? There's not much good in life that is when things are flat, right? So it can't move enough through range because it's lost its range. It's kind of floppy, right? So if apposition should be inhale, it goes down. Exhale, it comes back up again. So you could just do that with your hands. Inhale, everything goes down, which means the pelvic floor goes down with it. That's called a piston effect. And then as you exhale, it all comes back up together. So it's like all together now, like the Beatles sang. So inhale and exhale. What if your diaphragm looks like this though, and I image it and it looks pretty flat, right? What you're going to have is not much excursion. That means your breath is going to be really short. Your exhale is not going to be great. Your inhale is not going to be very great. You don't get that nice lymphatic pump, that kind of sump pump action. And what else happens? You don't get much stretch on the pelvic floor because it's already kind of flat. And so when you breathe, the pelvic floor may not move at all. What happens when a pelvic floor doesn't move? What happens when a muscle doesn't move? What happens when you don't move and you just sit around? You get stiff. Things get tight. It might even start hurting, even though there's not necessarily a pathology there. It's just that the tissues get tight. They get out of shape. Your pelvic floor, your vocal, diaphragm can get out of shape just like your respiratory diaphragm can get literally out of shape. And so that's what I look to image in the clinic. And there's all kinds of tips and tricks. If it was very simple to fix, then you could just watch this YouTube video and fix your own respiratory diaphragm. But I just want to tell you that there's to be encouraged, because if you have long COVID, pelvic pain, vocal issues, back pain, sacroiliac joint pain, pubic symphysis pain, endometriosis or painful bladder syndrome, excuse me, prolapse, pelvic organ prolapse. All of those things can be helped by just doing respiratory diaphragm imaging alone. So if you don't know where to access respiratory diaphragm imaging, which we use for biofeedback in real time, and then I train you on how to breathe correctly, which sounds easy, but it is a stepwise process because it involves all three diaphragms. If you can't find someone who's doing imaging nearby you, I am putting the link in the description so that you can reach out. If you are in the state of North Carolina, awesome. Take a day trip, come and see us. And I can do that for you. I do have people travel from out of state and out of country. I certainly can't see everyone, so I will try to point you in the direction of someone who does imaging in your area. However, this is an emerging expertise, and so there aren't a lot of people that are doing it because the technology is also expensive. So there's not a lot of clinics yet doing that in the United States, but there's a good number of them. So I will try to help you find it, point you in the right direction. And if you would like to come see me, I can see a limited number of people as well. I hope this video has been helpful and encouraging, that if you have any of those conditions, it can be very transformative and you can improve very quickly just from simply having respiratory diaphragm imaging and biofeedback in real time.